You're going to hear a lot about the Medway Model today, and we'll explain a little bit about what the Medway Model means shortly. However, I'm assuming that most of you are here today because you care about the NHS. Yes? Yes. Yes, good. Because there's a really important thing that I want to say up front in relation to the meeting that we've got today. You'll hear lots of jargon, and stop us when we talk about jargon. You'll hear lots of stuff, you'll hear data, you'll hear lots of things about the NHS, but the most important thing about the NHS is providing good quality care, good patient outcomes, and a great patient experience. And you'll notice as we go through the session this afternoon that there'll be lots of different people speaking to you, talking on panels, trying to engage with you for your views. And that may feel a little bit muddled at times. But I'm happy with that, and I hope you'll be a little bit happy with that, because actually it's great that we've got so many people in the room from different organisations across health and social care who want to engage with you, who want to talk with you about your experiences of health and social care services in Medway. So I'm really pleased to have been asked to take part in this event today. So thank you very much for coming. Okay, let's use these mics. I suspect people can hear. Is that better? God, that's going to be really scary, isn't it? Okay, so we will be taking you through an agenda shortly, but have you got any questions before we start proceedings? Yes, sir. When you speak, please can you introduce yourself, Stephen?
My name's Steve Wilkins, I'm Secretary of Medway Trade Union Council. What I was going to say at the start, I know we're going to have half an hour of panel discussion, but there is a lot of very complicated information.
Yep.
And I already, before we even started, have 8 questions, and we're not going to have time for those. So ideally, what I would like is that perhaps at the end, those of us who've still got questions haven't been answered, we give them in and you send them out to the questions and answers out to everybody at the end.
Yeah. Sounds like a very good idea, and in the interest of openness and accountability, that sounds great. We will certainly take those questions in, develop the answers and put them out on our website, Caroline, yeah? Any other quick questions before we start? Yes.
Elaine, member of the public, what's the deliverable from this meeting?
The deliverable from the meeting. Caroline, do you want to pick that one up before we start?
Okay, so I think the key thing is it's a joint deliverable by us working together. That's really what I want. So as organisations, we're trying to work a bit more closely together to provide what we need for you, and we've been doing that for a bit, and we want to tell you a bit about what it is we're doing. But what we want to hear from you is, does that sound right? How can we make it work better? What's the contribution that you have as members of your community or as patients in this? Because this isn't us and you, this is about us together. So actually what I'm hoping we'll get is some joint outcomes about what we might do, which refine the work that we do together and help us support communities in terms of what you can do.
Okay, now I'm really pleased that you asked that question. I've got your name. Elaine, because you are going to hear a bit about sustainability and transformation plans, a bit of lingo, but Caroline will explain that to you. I just want to read something out to you before I hand over to Caroline. Anybody here heard of the King's Fund? Yeah, you've heard of the King's Fund. They have written, they're a think tank, a health think tank, and they've recently written a paper about sustainability and transformation plans, and I just want to read it out to you because I think it speaks directly to the question Elaine has raised. It says, the key priority for sustainability and transformation plan leaders in the short term is to strengthen, here we go, involvement in the content of the plans. You're going to hear about the content of the plans in the next half an hour. Particularly among clinicians. Any clinicians in the room? A few, excellent. Clinicians, local authorities, anybody from local authorities here? Very good, good spattering. Local authorities, frontline staff, well there are some frontline staff here as well. Local authorities, patients and the public. Any patients in the public in the room, please? Exactly, thank you very much. So there's lots of patients in the public in the room. The next will be to equip staff with the skills and resources needed to implement the plans. Okay, so in answer to your question, Elaine, one of the reasons that you're here today is because they need to talk to all of you folk before they can develop their plans and take them forward. So that's one of the outcomes today, to get your feedback. Caroline, over to you.
So the first thing can I say is thank you very much. I know you have all got busy lives, other things you could be doing this afternoon. I hope the wind hasn't been too bad and caused lots of havoc for any of you. So thank you for coming along, because I know you could have been doing other things. So we do really value your time, and that's really important to us, so thank you for that. Lorraine mentioned the STP, so if I just talk about that very briefly to kind of get that out of the way. So the STP, some people kind of uncharitably call it the sticky toffee pudding. And it's kind of, sometimes it feels like a bit that, it's a little bit like wading through treacle, and it can be a bit hard going. But the thing is, it's about kind of how do we put all the ingredients together and actually do something together, as opposed to doing stuff on our own, which I think we kind of used to do in the past. So Kevin Medway has a sustainability and transformation plan. And this event is a listening event as part of a number of the listening events that are happening across the whole of Kevin Medway. Now, in Medway, we call that the Medway Model. And the reason for that is because although we're working within an overall framework about what things work and all that evidence stuff, what's really important to us is, and important to you, is how do we get things right for the population of Medway, and how do we think about how we get this to really work in our community and make connection with you. So on the earlier slide, I think you'll have seen we had lots of organisations. Can you just step back a bit? So the thing about the Medway Model is it's actually owned by everybody, by all of the organisations, and hopefully also by you, in terms of what it is we're trying to do to provide better care and support for people in our communities. So those are all the organisations. That's the only time you're going to see us all up there. What you're much more likely to see, is this logo, which is really, this is all about us all working together. And for me, this is a really important logo, because you'll hear us talking about Dorothy, and what we've been talking about with Dorothy is how do we actually all support Dorothy? How do we actually work together? Wrapping ourselves around Dorothy and what it is she needs and the things that are important to her. And we often spend our time talking about things like, what's physically the matter with people, as opposed to what are the goals that people have individually, what's important to them. Maybe it's important to be able to go to your lunch club, maybe it's important to you to do, be able to pick up your kids after school and go to play sports with them. So sometimes we get caught up in focusing on all the kind of physical and sometimes mental health stuff, but we don't think about those wider things. And that's actually the reason why we put the dog on. I insisted we put the dog on, because I know that, for a lot of people that we speak to, sometimes the things that's bothering them is sometimes the reason they don't access help is because actually they're more concerned about who looks after the children, who looks after their dog. So if we're going to work with people, we have to work with everybody and think about all of those things, and not think about the rigid boundaries of our organisations, because we're here to help you. It's not your job to fit in with us. So, we want to be challenged, we want to do things that are different, but I think it's also about recognising that can be, we've got to change too. We've got to change in a different way. We won't always get it right. And I think I would say, if I summarise what people often say to me if I talk to patients or to people in the community, most people say, could you just not always talk to one another? Could you stop asking me my health and social care history all of the time? Could you just not coordinate your care a bit better instead of me bouncing my way around the system? So in a way, what people are asking for is, it's not a lot, but we really struggle to do it. So if we're going to try and do that bit better, we need to do that with you. And we know that we need to change a bit, and we know we're not always going to get it right. So we're just going to talk a little bit about where we are, what we're doing, and I'm going to hand over to Helen, who's going to start that.
Thanks, Caroline. Hello, everyone. Caroline, you've got dogs, haven't you? Is this one of your dogs?
Yes.
Which one is it?
This is the Bonnie.
Bonnie. Okay. I'm really glad to be here today. My name is Helen Greatorex, and I'm proudly the Chief Executive of the Mental Health, Substance Misuse and Learning Disability Trust across the county. I was talking to colleagues this morning and saying that it's 34 years next month since I started my training as a mental health nurse. So I've worked exclusively in mental health. That's a big bright light, isn't it? Shall I stand just here? Oh, that's so much better. So I've worked in mental health services for 34 years, and I know we're still not getting it right. But I have to say, Caroline, you're exactly right. I think there's a real opportunity with these STPs. There are 44 of them across the country. We're one of the biggest. And I've only been a chief executive for a year, but I've never spent so much time with so many other key players from different organisations talking about how we get things right for patients, and that's what this is all about. And Elaine, I think your challenge at the beginning was absolutely right. So what, really? So what? So what comes out of this afternoon? How does what you all contribute, what we hear from you, help us shape what we do? Well, I can promise you that it will, and it does, and it will continue to. So, let's have those bold conversations and say it how it is. I've got just a few slides just setting the context, really. And I suspect lots of you in the room will already know these things, but it's just helpful to remind ourselves that our population is growing, and it's the fastest, highest growth rate in any area across Kent, so there's something very particular about that. We've got more people in Medway who have long-term conditions, diabetes, lung, heart disease, and I would include mental health in there too. And we've got, you can see at the bottom here, the 20% increase in number of people over the age of 70. Well, that's great, lots of experience and life skills on the patch, but along with ageing come multiple additional needs. And really important there on the bottom right-hand corner is a statistic that those of us who work in mental health are really familiar with. 1 in 4 of us in the entire population, 1 in 4, will have a mental health problem at some point in our life. So a quarter of this room, 1 in 4. That doesn't necessarily mean that we'll need hospitalisation, but it means that we'll need some form of treatment. It might be with a GP, it could be with talking therapies, it might be through a voluntary sector, but that's a significant issue. And it's one that we're really keen in the trust that I'm part of, in making sure that we deliver care as close to home as possible. So not taking people miles out of the county, not being able to provide care as close to home as possible, and really making sure that if you come into hospital it's only as a very last resort, because we've done everything else we can 7 days a week, 24 hours a day if that's what's needed, to keep people at home. Just to share, one of the examples I would share about what we've changed in my organisation as part of transforming care is to stop people having to go into private beds. So when I joined in summer 2016, we had 76 patients from across Kent and Medway, and I'm seeing nods around the room, so some of you may have personal experience of this. 76 patients were placed in private beds. So these were beds that could be in Hull, they might be in Manchester, they could be on Arran. They were private beds, and they were for people who needed admission to hospital. Everything else had been tried and they clearly needed to come in, and my organisation didn't have space for them. So, of course, if someone needs admission, you find a bed, but your heart sinks if it's in Manchester for someone who's 65 at 2 o'clock in the morning. We set ourselves an ambitious target of stopping that, and we did it through clinical leadership, and clinical colleagues in the room were part of those conversations, reorganising how we did things, making sure that the right person gets the right care in the right place at the right time. Sounds simple, and actually the principle is simple, but it's putting the person at the heart of what you're doing and making sure that that's what happens. So just to give you an example then, those 76 patients were costing over £1 million a month. My budget in the organisation is around 175 million. So we were spending £1 million of our money, taxpayers' money, that we didn't have on poor quality care. Even if those beds had been free, it would have been all sorts of wrong. Even if they were free, because the quality of care that you're able to receive in a place that doesn't know you, with a team that doesn't know you, is, even if it's a lovely place and you've got high calibre staff, it's not the same as receiving it in your local area where you can be in touch with friends and families and supported to go home when you're ready by a team that's going to support you in the community. So I share that with you as an example of how you can drive up quality and reduce costs. And as I stand here today, we don't have anyone in private beds unless they're for very particular specialist needs. So my sense as a chief executive, new to being a chief executive, new to Kent, I come from next door, Sussex, is that actually this is really helpful stuff. If it's putting the patient at the heart of what we do and saying we can't go on like this, we're going to drive ourselves into bankruptcy, and that's what we're doing in the NHS, unless we stop this now, focus on quality, take cost out, and the two things will go together. It's a real opportunity. So I don't think it has to be complicated, although, as Caroline said, when it comes to organisations working with each other, sometimes it can become more so. Challenges in Medway, I mean, lots of you obviously will know and love, I'm sure, MFT, Medway Maritime, well-established hospital. In fact, I was there yesterday, and you've got some statistics here that are helpful. This one, I think, is really topical. What are we going to do when we haven't got enough GPs? How difficult is it to get a GP appointment currently? What could we be avoiding coming to hospital with if only the GP service or the community service could be better? So how might we solve that? And this is really interesting, isn't it? 1 in 3 hospital beds, someone's there and they don't need to be there. They could be somewhere else if only. So how can we do that? You will have answers in this room. There will be suggestions, answers and experiences that will help us shape our thinking. Yeah, look at this. 44 million in the red and rising. Got to do something. And you know, that in combination with care that isn't consistently high quality at every point you touch the NHS across the patch isn't where we want to be. I think that's me closing. Yeah, it is. I'll hand over. Thank you.
Okay. So I'm going to stand on this side because can everyone who's able to just stand up for me? Give your legs a little shake. That's right. Give your arms a little wave without knocking anyone out. Okay, you can sit back down. How long are we meant to sit for? Does anyone know? Where's my physios? Any physios in the room? 20 minutes, about 20 minutes. And then we start having problems with a saggy position, which isn't good. So I think I'm meant to be talking about what you told us. So last year, we looked at a survey of our population, and there were a lot of things that came out from that we hope we'll build on today. And some of the things are up there. So we said, you don't want to go to hospital unless you really need to. And that, I think, is common sense, but quite clearly we're not doing as well as we could be at things like that. You'd like better access to GPs and other healthcare professionals. I think Caroline's already outlined some of the challenges that we face and some of the recognition that some of the things that we're currently doing do not allow us to do those things. GPs don't always have enough time. Any GPs in the room? Nobody only know. You'd be getting a rush. Because it isn't always just about the time, is it? It's about the quality of the interaction. And sometimes perhaps it's not the GP that we need to talk to. Clearly, sometimes it might well be. It feels as if people don't talk to each other. And Caroline's already expanded on that around the communication, the interface that we need to do as organisations that are working together to provide care and support for people in Medway. You just heard Helen talking about improving mental care for young people. Now, yesterday at the Health and Wellbeing Board, and if anyone hasn't visited one of the Health and Wellbeing Boards, please do so. They're on the council website. You can come along and provide your contributions. But what was presented there was a new service model that's going to be delivered across Kent, it was in Kent, but across Medway, that will focus on Medway people and delivering support for young people, and that's up to 25 within Medway, and we think that's a really good innovation. So these things are happening. But actually there's one thing here about more help for elderly people. Anyone here elderly? Yeah. Put your hand down.
10, 14, 5.
Put it down. Because what is elderly? It's all about function, isn't it? So we can call ourselves old if we want to, but actually it's what are people able to do, and age sometimes is just a number. But what we've already heard about is Dorothy. So we've got a little model, and we're going to talk a little bit about Dorothy now. So when we talk about Dorothy, we're talking here about somebody who might need a bit of support. And Dorothy, she's a little bit frail. She's got breathing problems. Everyone know about chronic obstructive pulmonary disease? Okay, we don't like those acronyms, do we? She just has a bit of a drama when she's walking upstairs sometimes. She's got type 2 diabetes, she might have high blood pressure. She's not feeling too good about herself because she's got all these long-term conditions, so she doesn't feel well, so that then links into a mental health condition. And she's looked after by her husband, John, who cares for her. Now what we're trying to do is to make sure that Dorothy, first and foremost, is able to maintain her independence. Anyone here make a cup of tea for themselves? It's a basic skill, isn't it, in a task that we don't want to do. And being able to do that helps us to retain our dignity as well, doesn't it? So what we're trying to do first and foremost is ensure that Dorothy can maintain her independence, and we're going to go full square for that, because that's what it's about. And a lot of the initiatives that you will start to hear about as we go through this workshop, and maybe you'll give us some more suggestions from the floor, will be about how we can prevent Dorothy from being unable to look after herself, because that's where we want it to be, about self-management. The next bit then, if she needs a bit of care and support, then we're going to put the team around her and organise that care in an efficient way, so there'll be a single point of contact. And that'll be done through people, we'll call them care navigators, you can call them other things, but it'll be a single point of contact. So Dorothy and her team that are working around her know who to go to, and that person will be able to then support Dorothy without her then having to ring X and ring Y and ring Z, or if it's John, calling X, Y and Z and getting different stories from different people. We're going to try and do that. Anyone had a fall other than being on a Friday night or a Saturday night out down in Rochester having a bit to... You don't tell me. I'm Director of Public Health, remember, we're meant to keep our alcohol content down. But we do recognise that as people get a little bit older, they might become a bit more frail, and that might lead into falls. And we know that fragility fractures, that's when perhaps your bones are a little bit less resilient than they should be, but actual hip fractures cost a lot of money, but not only doing that, they also can be proved fatal and also lead to people ending up in care homes and other things. So we've been doing quite a lot of work and being quite innovative and working with, am I allowed to say this? Are you going to pick it up later?
It's okay.
I won't say it then, I'm not going to say okay. But we're trying to think outside of the box. So you know those folk that run around sometimes and put fires out? So they also go into people's houses and they've got a really good eye for detail, particularly in things that hazards that might be a problem. So working with the fire service and other organisations like that, and we've done, what is it, over 400 now? 600 and rising, it's 400 only a couple of weeks, so they're quite good assessments to make sure that Dorothy and people like her can remain safe in their own home. The other bit here is about your experts when you want it. So we're trying to make sure that you've got a multidisciplinary team that is able to deal with the problems that arise, and that you can go to one place, receive the care and support and the treatment without then having to be bounced around the system. And I think that was something that Caroline mentioned earlier on, and it is central to the Medway model and how we operate. One phone number to call, single point of contact. Because what we're also trying to do is to do things in different ways. Anyone here got a tablet device? Anyone got a teenager or a grandchild that can help you use it? My daughter has to help me out. The other day I had this thing on my smartphone. It was a type of brand, and I won't advertise it here, and I couldn't get it off. And she literally just went, what, within about 30 seconds I went. So there are lots of innovations out there that we need to start using that will enable us to do things a lot simpler. But having a phone call is a safety net. If people, however, do need to go into hospital, we want them as home as soon as we can, and we're doing as much as we can. Get people out early, because you don't want to stay in a hospital bed. Can I say, I'll tell a personal story, shall I? And it's not from a hospital around here. You can hear from the accent that I'm not from these parts, although I've lived down here quite a long time. Anyone know where I'm from? Oh, no. Okay. Alright, so we do drop the U's, wrong county. Well, right county, but wrong area. West Yorkshire, I'm from Huddersfield. And my mum was admitted, she's 89, and she's a bit like Dorothy, to be fair, but she's a little bit more resilient. She's got an allotment, and the allotment is about, I would say, about an acre, because we've got a lot of land up there that needs to be used in Yorkshire, as you know. But she goes out there and she manages it, but for a period of time she was a bit poorly and she had to go into hospital. And that experience, I can tell you, I was driving up and down, wasn't good for her. It really wasn't good, because we wanted her out and she could come out, but they were trying to do all these other kind of things. And all she wanted to do was to go home and to get back into her environment. We got her out in time, because the longer people stay, particularly older people in hospitals and those types of places, the more likely it is that they're not able to readjust and get back into their normal sort of way of life. So in terms of that, getting people out of hospital, stopping them getting there in the first place, and if we do have to put them in there, making sure that we can support them is really important to us, and you'll hear about some of the discharge programmes and things that we're doing later on in this session. And then the final bit is the thing around diagnostics and tests and stuff. Anyone here had to wait months, years for a test? No, I'm just saying, I'm just joking, you shouldn't have to wait months or years, but it seems like that for your test results, for somebody to then do something, or you go for an appointment, somebody says your results aren't in yet. We're going to draw a line under that. We're actually going to make sure that we simplify and speed up the way in which all of our diagnostic tests and the people that are accessing those, your GPs and other types of colleagues, their ability to read across information systems to get that information at the point of care. Okay, so we talked a little bit more about Dorothy, and now we're going to go into how we provide additional support.
Good afternoon, everybody. My name is Helen Martin. I'm one of the directors at Medway Community Health Services, known as MCH, and I'm also a local resident of Medway and a district nurse by background, and so I'm very proud to be sharing with you some of the things that we've been doing in bringing together our organisations, our services, our professionals, that we hope will help address some of these many issues that have been highlighted by my colleagues today. So my little bit is about an example of how we're bringing together teams and resources and making good use of some of the estates and premises that we have available to us in Medway. So I'd like to talk to you about the health and wellbeing centres and extended access to GP services, and I would also say access to other health and social care services. I'm sure some of you will be very familiar, although this is an architect's design, I do think this is Rochester Healthy Living Centre, so some of you will be very familiar with these centres that we've got around Medway, and we want to make good use of those centres, and I'll go on to explain some of the things that we're going to provide from those. And so working together with the Medway GPs, we've started to bring those Medway teams together, those Medway GPs together to create teams or hubs. And those GP practices are coming together to cover a larger population of patients. But please don't think that means that the resource is going to be scarcer. Actually, we want to take all the skills and experience that we've got from across those practices to make those more available to patients. So although you might be registered with a particular practice, you'll be able to access services, get appointments same day, and in fact we've even started piloting that for minor illnesses at the moment, so that everybody will be able to get an appointment on the same day. And I think that's one of the areas that we certainly listen to you, and I know it's not just a local problem, it's national. I've experienced it myself, where you just can't get that appointment on the same day, and we think that's really quite critical for you to be able to access services in that way. So over the time we will be bringing those GP practices together. They'll be formed into hubs. But more importantly, it's not just about the GPs, it's around the services, the professionals, the local community that they serve, and it's about bringing that resource together. And when I talk about the resource, I'm talking about people that you probably already see, your community nurses, social workers, it might be some of the voluntary sector that you or your family or carers access. And taking all the points that we described earlier on about you sharing your story once, having more joined up care, sharing information that we've got about you, we want to actually make that much more formal. And to do that, we're bringing our teams and our resources together, forgetting the fact that we might be different organisations, one might be healthcare, one might be social care, taking those boundaries and barriers away and saying, if we remember that the patient, the public, are at the heart of everything we do, we can actually create services and provide what you need to help you achieve those goals that we talked about right at the beginning. So we will be creating integrated health and social care teams. Those will have those professionals and resources that we've already talked about, and they will be there to serve you, the public and patients, families and carers. And they will be operating and functioning from the centres that we've got, and we will then be able to develop those services for that area. So what does this look like for you? So yes, you'll still be registered with a local GP. When things get complicated, you'll have a named person. We talked about the care coordinator earlier on, but it might be one of the staff, the professionals that you already see, and they'll help you find your way around those services. So you won't have to make lots of phone calls, have lots of different referrals, share your story 25 times and still have to repeat it at each visit. Social services will be in that locality, so as I said, it's not just about healthcare. It'll involve, it's for adults and children. We'll come on, I think, to talk a little bit about children's services, but it'll include midwives, health visitors, community nurses, all the different professionals that you'd expect to be able to access. We will be certainly looking at care close at home. I think we do a lot of it now. I think we do it well. I think we'd like to do it a lot more. So we want to look at moving more things like outpatient appointments out there. And as I said, you will be able to book an appointment with your GP practice. You should be able to get a same-day appointment if that's what you need. But more importantly, by doing all of this work in the community and working with you, we think we'll be able to free up more of that hospital for those time, the A&E time, for those life-threatening emergencies. So when you really need it, it'll be there and ready for you. Okay, I think that's over to you, Carol.
Thank you. So back to me for a bit. Okay, so I just want to talk about the partnerships between hospitals and local care teams. So we've been talking about some things that we're hoping to do in the future, and we've talked about one or two things that we've started. So we just want to talk about one or two things that we've started that you'll start to see roll out. So Helen talked about the minor injuries clinic, and we've just started that last week in Rochester. So from any one of those 4 practices, you can actually phone up and go and be seen at the Healthy Living Centre by a GP from any of those practices, and they're working together. And that is us beginning to test how we actually make practices work together in a better way, which uses their resources better and creates more access for you. So that's an example of one thing that we're doing. Another thing that we're doing is we know that a lot of people who are frail and elderly, once we've got to the point where you've fallen over, once we've got to the point where you're admitted to hospital, so if you've been in hospital 10 days, your muscle wastage is about 10 years worth of muscle wastage in 10 days. So people stay in hospital for 10, 15 days. Going home is a lot less likely. So we know that we've got to actually work with people before we get to that point. So these 2 things that we're doing are about how do we help older people stay independently as long as possible. So we've been running a number of clinics, we call them the PACE clinics. So these are proactive clinics where we look through, and there's it's called the e-referral frailty, the e-frailty index. So we can look through all our GP records, and there are a number of markers that help you know how frail people are, whether you're severe, moderate or mild. That's how it's broken up. And we've been inviting those patients to come to a clinic, and we have the community geriatrician who's come out from the hospital, and he's been running clinic together with people from the other organisations. And so far we've had 270 people go to those clinics. We've run 70 plus clinics. We've been identifying lots of really interesting things, maybe not surprised, issues that people have with their medication, and that combination of medication, so that's all been reviewed. We've spotted a number of diagnoses, things that were wrong with people that hadn't actually been identified, and we've been able to put in plans for those patients, including referring people on to things like, for example, the Falls Prevention Service. So we've been running a pilot in Woodlands for 7 or 8 months now, and in August we've rolled that out to the other Healthy Living Centres. So if you've not seen that yet, that's starting to be coming in your direction now. And that's about us being really proactive, inviting people who, there's no reason they didn't come to us, we went to them, and the feedback from that clinic's been excellent. And it's interesting because it's been a really good use of resource, because we're providing that service locally on your local geography. And we know that there were some clinics running before in the acute hospital, and the rates of people turning up, the DNA rate was over 30% of people didn't actually turn up to that appointment in the hospital. And when we ran them in the community, the did not turn up rate was 8%. And of those 8%, because those people actually were people who were sick on the day. So there weren't people who didn't want to come. They were all really able to come. So that was good. So you'll see more of that, and that's about helping people keep as independent as possible. So our aim is to try and stop really elderly people going into hospital unless they really need to do that. And we know that makes a big difference to your ability to stay independent for longer. So the other interesting thing that we've been doing is we approached the fire service in Kent, and we said, well, we'd like to work with you because we know you've got some volunteers, and we know that you're going out to people's homes, lots of real elderly people, and you're doing all the fire detection things. How would you feel about doing some work with us about supporting those people and doing assessments in their homes? And we've seen some other places, there's some really great work going on in Canterbury, New Zealand, where we've seen this working, and they were absolutely up for that. And so the geriatrician came in, did some training with all of those fire personnel, and they've done over 600 visits now. So when they go out, they do a little mini assessment. So in mini assessment, they're looking in people's houses and helping them work out things that are dangers. They do an assessment which he's taught them to do, and we actually let them refer directly to the falls prevention team because we know they've had that training, and that's been really good. So that's another way of us helping people proactively. So these aren't people that we didn't even identify them off our database. We're going to see them anyway, or they were going to see them anyway. And some of the things that we're doing aren't that surprising. So they've changed loads and loads of light bulbs. I wouldn't surprise you with it. LED light bulbs are great, but they're not very bright sometimes, so that's been a big problem. Taking away people's old rugs, helping people who maybe had kind of issues with their carpets, and sorting out. There's kind of stuff you can put on to cover up holes that you've got. Helping people think about, is their house unsafe? What about their fire? So we've been doing some really, really interesting things, and that's been great. So that's all about how do we do things more proactively. So we're continuing to do that, and we'll continue to roll that out, but I think that's a great innovation. So if you know anybody who's been offered that service, please encourage them to say yes. We've had one or two people who the fire service have wanted to refer on, and people haven't wanted to do that because they've been a little bit worried that would mean that they might end up in a residential or a nursing home. So it's exactly the opposite of what we're trying to do. What we're trying to do is to make sure that people don't get admitted to hospital, so don't end up in a nursing home. So again, if anybody asks you, you can encourage them. We're trying to do exactly that. We're trying to help people stay in their own homes. So they're a couple of the things that we've been doing. There's a real role, I think, in terms of technology. There are some things we're doing already. There's some new things that we need to do. So we've been rolling out a text messaging system. So if you've got an appointment at your GPs, most of our GPs are doing this now, you'll get a little text to remind you. If you no longer need the appointment, you can cancel that appointment. We are now seeing 800 appointments a month being cancelled, so that's 10,000 appointments a year that we have more simply because people are cancelling when they get the text and it doesn't suit them when they're not planning to come to the GP appointment. One way you can help us is, can you please give your mobile telephone number to your GP practice and tell them they can send you texts, and can you encourage other people to do that? Because that's been really, really successful. Practices have started to use this to encourage people to come for example, their annual diabetic assessment. In fact, it's so good that one of our practices, when they got it, I think they sent out an annual diabetes check reminder to 80 of their patients. And in the next 20 minutes, 75 of them phoned up. So they weren't hugely important. So we've learned something about that, doing it in batches. So please do that. There are some apps like Health Help Now. I think it's good if you can do that. For some of you who can register with the GP app, Know My Patient. I must admit, I had something I should have done, so I decided to do that myself about 6 months ago. And it is a bit of a faff, to be honest, because you have to take in your passport and your gas bill. And I'll be honest, I found that a bit annoying. And then I had to wait for about 6 weeks before somebody sent me a code, by which time I'd slightly lost interest. So to be honest, I didn't register. And about 3 weeks ago, I thought, oh, I must do that. So I downloaded the app and I registered. It's quite unbelievable, all the information I could get looking at my records. It's gone back at things like happened in my childhood, and I was like, that's amazing. And you could, and I don't take lots of medication, but you could have had all your medication on there, and I could have booked appointments. So, do you know, although it was a bit annoying to do it, once I got it, I was kind of thinking, I wish I'd done this before, this was actually quite handy. So, you know, some of these things are really, really good. And we're going to be testing lots of new technology going forwards. So, I guess the ask from us is, you know, can you be open to that? And can you tell us about what works or doesn't work so well for you so we can make that technology work? Lots of people now are choosing to use to have telephone appointments with their GPs rather than necessarily come in, and we know that that allows us to see more people. So again, you know, it's worth a try. And if it's something you try it once, if you don't like it, that's fine. But a lot of people find that really helpful. So we know that technology is part of the answer. There aren't going to be loads and loads of new GPs. However much we might want that, however much I wish I could stand here and say, I've got an enormous recruitment campaign and I'm going to have loads more GPs, that's just not going to happen. So what we actually have to do is to use the GP resource that we've got in a better way. We used to use a mix of other people who actually can provide some of the services you want, and we need to use technology. So I guess again the ask from us is, general practice is not going to be the same as it was previously. It's going to be different, and the current model just won't cope with the demand, and you're already seeing that. So we need to kind of make some of those changes. So again, it's about if you just want to be seen today and you're not that bothered about which GP it was, then using the system that we've been setting up, which says, you know, I can just go along, don't mind which GP I see, that's great, because for the people who do need to see a consistent GP because they've got a long-term condition and they need that connection, if those of us who don't need to see a particular person in one day choose to be more flexible, we make it better for everybody. So that's really helpful. So what we're trying to do is, so we know that access is patchy at the moment, we know it's difficult to get an appointment. We know sometimes people turn up at A&E because it's just too difficult to get an appointment in primary care. And we know you don't necessarily want to do that, but that's what people do at the end of the day. If if it's too difficult, then eventually you become so worried about something that you think, I really have to do something about this now, and we don't understand that. So that's what happens now. So what we've got to do in the future is to actually be more consistent. We need to find ways of including social care. So we talked about care navigators, we talked about getting access to a range of people. You know, some of the clever technology that you have, or we talk about things like single points of access, which James mentioned earlier. You know, if you're a frail elderly person and you can phone us up and we recognise you from your mobile telephone number, and we can get your record and say, oh Dorothy, right, that's great, I see the district nurse came out to see you yesterday. Well, I'll tell you what, given that problem you've got, I'll give her a phone and get her to phone you back, because I think she's probably the right person. So we need to get to the point where we're looking at technological solutions which will eventually get us to that point. So we're working our way towards that, but I think that's probably the way to go. So we talked quite a bit about frail elderly people, or older people, or adults with complex needs. And the truth is that frail elderly people, there are about 23% of the population, and we spend about 40% of the resource in the health service on people who are frail and elderly. And if you add on complex adults to that, that kind of gives you a kind of idea of the kind of, that adds up to the spend, probably gets us nearer 50%. But we also spend a lot of time and energy and money in terms of providing services for children. And there's quite a bit of work going on at the moment about how we manage that, and a lot of that is about how do we work together across those boundaries. So we have a number of procurements that are currently going on. We're looking at our community services, and we're doing that together with the council, who are also looking at school nursing services and health visiting services. So we're looking at those things together and trying to find ways of thinking about how can we provide that more streamlined service, working together with you. So those are some changes and some procurements that are already ongoing. We will be, in autumn, opening the new Child Development Centre. And you know, that's, when I first came here, which was about 18 months ago, one of the first things I did was I went to, somebody invited me to go and visit the centre where we provided care for children with complex needs. And it was small and pokey, nothing like big enough. really totally inadequate facilities. And I went a couple of weeks ago for a walk around the new Child Development Centre, and it's probably the best day I've had since I've been here. Honestly, see, when you get to see it, it is absolutely lovely. It is it's so much bigger than we had before. Lovely facilities. And I met the staff that I'd actually met 18 months previously, and they were just delighted. So, so it's nice to see that's a change in the development you're seeing coming very soon. So that is opening in autumn, so not very long now. So let me just talk a little bit about involving local people. So there are a number of things we're doing. This kind of event is one of those things. But we're also doing some other things because we realise that that's really important. So the CCG has funded a project called Involving Medway. And this is about recognising that we've actually got to do this together. And, I know with a number of people that I've spoken, people will say, well, some of the stuff that you want to do, some of the things you're trying to tackle, actually we're better as communities at doing that than you are. So we know that social isolation is a big reason why lots of people end up in the hospital sector or at the general practice. And the truth is, we don't really have the answer to that. So yes, there's some things for people who kind of got mental health challenges, but mostly if people are just socially isolated, that's not going to be helped by many of the things that we can provide. It's actually going to be helped by doing things in communities and us helping develop that. So this is about us spending a bit of time helping do that. So we've put in some money into some small grants, so for community type organisations who are doing things that will help and support in people in their own local communities. We've been working with a company called Spice Credits to start a thing called the Medway Credits. So it's encouraging volunteering. So for every hour of volunteering, actually what you can do is we give you Medway 10 credit and you can barter that back, and the council have been really helpful because they've actually letting us spend those 10 credits in things like the leisure facilities in Medway. So we've just started that, so that's really helpful. Medway Voluntary Action have done a great piece of work by looking at all the directories we're using of all the services that are out there for people to use and getting that all up to date so that we can actually signpost you to a whole range of other things that might be helpful to you. And in fact, we were just saying we've just been sending a link for that out to all the general practices because you might be surprised they don't actually have ready access to all of that. So we're trying to make it easier for you general practice to say to you, well, there's a group down the road that you might know about. So we've been doing a bit of that. So what does this all mean for you? So it's about, we've been talking about self-care. So some of what we have to do is to help you be better in terms of looking at your own health. You are often, you are the greatest expert in your own health. You know what feels right and not right. You frequently know what the issue is before you come into our services. So we really need to help support people round about that. We need to connect up care across organisations. We want to provide high quality care, that's the most important thing for us. We know that people want to have more services locally, and we know that when you need to travel to hospital, you're willing to do that. But if we can provide more things locally, and you have to travel less, that actually makes that easier for everybody. And we need to fight, and it's important that what we do is we spend public money in the best way. And we know that at the minute, because we actually all work separately, that sometimes we've got lots of our staff all working with you, which we coordinated ourselves a bit better. It'd be easier for you because you'd have less people to interact with, but actually you would get more resource. You would get more out of that, and we could also release resource to help other people. So it's about us trying to do all of that.